Hi, I'm Dr. Jeffrey Brown. Thank you for watching Power to Heal. Now, are you frustrated and wondering why you are still dealing with acne as an adult? So in this video, I'm going to discuss why you are suffering like a teenager and how you can achieve healthy, clear-looking skin. Now, acne is the most common skin disorder in the United States. It affects nearly 80% of the population during their lifetime. 50% of women in their 20s and 25% of women in their 40s gets hormonal acne. Adult acne can range from blackheads to whiteheads and to painful cysts. Adult acne can occur on the chin, around the mouth and jawline. It can also occur on your back, your chest, and your shoulders. Acne is caused by clogged pores. Clogged pores are the result of three things: bacteria, dead skin cells, and excess sebum. Sebum is an oily substance produced from the sebaceous glands located in the middle layer of our skin. Hormonal acne is linked to overproduction of sebum. Hormone fluctuations in testosterone, estrogen, and progesterone, especially during menstruation, pregnancy, and menopause, are prime times when acne can occur. Women with polycystic ovarian syndrome, also known as PCOS, they are prone to acne. PCOS is a condition where the ovaries produce more androgens like testosterone and DHEA, which in addition to the oily skin and acne, can cause excess facial and body hair. Now, if you want to have clear, healthy looking skin, you must first be healthy on the inside. All right. Studies show that people with acne have less estrogen, more testosterone, and more insulin than those with clear skin. So having a healthy gut microbiome is the key to having clear, healthy looking skin. Some gut microbes can make hormones like testosterone, while others make beta-glucuronidase, which is an enzyme that can change the estrogen levels in our body. The gut microbiome is made of trillions of microbes, bacteria, fungi, and more. A balanced gut microbiome limits the amount of inflammation that occurs in the body and helps maintain a healthy intestinal barrier. Now, when the intestinal barrier is compromised, also known as leaky gut, it can trigger or contribute to chronic inflammation, leading to increased acne, fatigue, skin inflammation, food sensitivities, bloating, and much more. Leaky gut allows harmful microbes, into our bloodstream, which can reach our skin and cause irritation and breakouts. Beneficial bacteria produce short-chain fatty acids, which help maintain healthy gut barrier. Now, microbes that are influencing the signaling pathways may also influence which bacteria grow on your skin. Our gut and skin communicate through the immune system, a process called the gut-skin axis. Gut microbes make immune cells which send signals that will either calm or inflame your skin. Research shows the key difference in the gut microbiome of people with and without acne is those who suffer from acne usually have 1, a lower diversity of bacteria, 2, fewer beneficial bacteria, which leads to lower levels of the short-chain fatty acids. All right, making bacteria like bifidobacterium and lactobacillus. All right, as I stated earlier, the short-chain fatty acids help maintain a healthy gut barrier. Having a healthy immune system produces macrophages that eat the dead cells from your skin. As I stated earlier also, dead skin clogs your pores, which can lead to acne. Now, you can also have your gut health evaluated, through a comprehensive stool test. It will show you your levels of good and bad bacteria. It will show you if there's enough diversity, in your gut bacteria. It will measure your beta-glucuronidase levels, which influence your estrogen levels, and it will also measure the inflammation levels, as well as your immune health and much more. So, I recommend that you find a functional medicine provider who is familiar with the comprehensive stool test and can help you optimize your gut health. Now let's talk about treatment and prevention. Having a healthy gut starts with what you put in your mouth. Eat a whole food-based diet. That means foods that come from the sky, the water, or the land, right? Not foods that were made and packaged. Eat prebiotics like onions, garlic, asparagus that feed the good bacteria. Eat foods that are high in zinc like oysters, crab, pumpkin seeds, and cashews. Zinc has been shown to help with acne. All right, eat salmon and other oily, fatty fish to reduce inflammation. Avoid foods that cause inflammation, and we know these. Sugar, right? It raises insulin levels, and as I previously stated, people with higher insulin levels have more acne. Processed foods, processed meats, avoid those. Saturated fats like fried foods, pizza, red meats, dairy. These are inflammatory foods. You need to reduce or cut out the alcohol. Take a quality probiotic that may be helpful to adding good bacteria to your gut flora. Those who suffer from abdominal pain, or cramping, like bloating or burping, especially after meals, you may suffer from having low stomach acid. 40% of people with acne suffer from low stomach acid. So if you're one of those people, try putting 1 tablespoon of apple cider vinegar in a glass of water and drink it 15 minutes before eating. Now, I also recommend that you put a few drops of stevia, in that glass of water for the taste. Having more acid will allow you to break down your food better, and also to allow you to have better nutrient absorption. Now, rinse your mouth out with water afterwards to avoid any effects that it may have on your teeth enamel. All right. Next, stress. Stress is another cause of adult acne. Increased cortisol during stressful periods results in chronic inflammation, which leads to increased sebum production, blocked pores, and acne production. Having daily stress-reducing activities is also very important. I speak about this in virtually every video that I have because it is linked to every major cause of disease out there. So I recommend praying, daily devotional and scripture reading, meditation, yoga, deep breathing exercises, regular laughing, sitting outside, watching the sunset or rise, playing with your pets, and there's more activities. You get the point, but really every day work on doing something to reduce our stress. All right, so I recommend 10 to 15 minutes, 3 times a day. Get out of that fight or flight and get into the rest and digest. Improve that parasympathetic system. That's going to help you tremendously. Now I want to discuss some natural alternatives to commonly prescribed medications for acne. All right, number 1 is spironolactone. Right, it's a common medication prescribed for acne. It lowers testosterone. It's a blood pressure medication, and it's also a potassium-sparing diuretic. So instead of that medication, because every medication comes with some side effects, you can try drinking 2 or 3 cups of spearmint tea daily. It's a natural alternative that also lowers testosterone without the side effects. Also, saw palmetto comes from a tree that stops the conversion of testosterone to the more potent DHT. It also contains fatty acids, which can keep the skin hydrated. It also prevents hormonal hair loss. Now, the other medication is topical benzoyl peroxide, or even antibiotics topically that they can use to treat acne. Tea tree oil is an essential oil that fights bacteria and decreases oil production without drying out your skin, and also has fewer side effects. Tretinoin topical is also another prescription. It's a form of vitamin A that's commonly prescribed. Now, beef liver is an alternative. It contains higher levels of preformed vitamin A, and this form is most easily absorbed and utilized in our skin to reduce acne. Now, if the thought of eating beef liver, kind of grosses you out, which it does me, then get some beef liver capsules, right? There are quality companies out there who make them. Now, taking vitamin A supplements can be tricky, as too much vitamin A can be toxic to the body, right? Studies show that 100,000 units of vitamin A can be helpful in treating acne. But I recommend working with a physician if you're going to be taking vitamin A. In summary, I want to discuss a 10-step approach to improve your skin and prevent future adult acne. Number 1, don't pick or squeeze the acne that you have. All right. Number 2, use gentle skincare. All right. Avoid the rough facial scrubs. Number 3, keep your skin hydrated. Number 4, use a moisturizer without oil and that won't clog your pores. Number 5, use naturally based products that don't contain chemicals and endocrine disruptors. That basically means these are chemicals that disrupt how your hormones naturally work. All right, number 6, eat a whole food-based diet. Number 7, use natural products like tea tree oils, saw palmetto, beef liver that we spoke about. Number 8, incorporate daily stress-reducing activities. Try to get to 3 times a day. Number 9, get a comprehensive stool test done so you can address your imbalances there. And number 10, get your hormones checked. And then, of course, get them balanced. Now, if you do these 10 steps, your acne can be a thing of the past because you got to the root of the problem. So, thank you for watching. Thank you for listening. I hope you learned something. If you did enjoy the video, please send to your loved ones, family, and friends. Please like our channel, subscribe to our channel, and remember, you have the power to heal. Thank you.